Well, good morning to you, Victor, and thank you very much indeed. We are in Uasin Gishu County, and of course, we are casting our eyes on the Devolution Conference, and of course, we'll be going through each and everything that will be happening here in Uasin Gishu County for the next 4 days. So then, of course, our viewers and listeners across the country will be getting first-hand information of what will be discussed here, the lessons, and of course, the challenges that they've gone through for the last 10 years. But more importantly, as you've rightly put it, it is 10 years into devolution, and of course there's quite a lot that has been achieved along the way, and of course there've also been challenges. The question then is that then how do we leverage on the success that we've actually achieved over the last 10 years, and moving forward, how then do we ensure that then we can surmount the challenges that come along our way? Of course, we'll be talking to many guests while we are here in Uasin Gishu County, but the first guest to actually give us an insight of what he's actually doing in his county is His Excellency Gideon Mung'aro, the Governor of Kilifi County. Karibu, Governor.
Thank you.
Of course, we'll go straight into it. I'm hoping that watu wa Kilifi wako salama.
Wako salama kabisa.
Mambo ya security, kila kitu iko sawa kule.
Kila kitu iko sawa. We have started slowly. You guys at least have realized slowly you are not putting us more focus on Shakahola. You are putting on other things. So we are glad.
Lakini of course, people out there will be asking themselves how we actually doing to ensure that we deal with that situation, because it was a serious issue.
Yeah, you know, it's a national security issue, but it has taught us lessons as a county that probably our ward administrators, and soon will be also creating the last tier of government, the village administrators. Probably that way we'll be able also to have first-hand information ourselves. Initially, I think we relied more on national government security, and we realized that also there were some lapses on the same. So we hope in the near future, when you have now village administrators as a county, we'll be able to get more information once in a while.
Not just for security purposes, but when you're talking about village administrators, there are key issues that of course, your government is implementing in the county government, and of course their role in terms of ensuring that the people on the ground can actually get to understand what you're doing is key. Let's talk about health. Where are we in terms of health?
On health, I know there were many challenges when I took over. When I took over, we realized that we didn't have we had two things they were facing in health. One, there was a drug shortage. Two, which we are going to sort out soon, because we have just created the new public service board. It's finalizing in the assembly. The problem we have is when we had the drug issue, mostly was because of KEMSA payments. The first thing I did when it came to pending bills, the first pending bills I concentrated on was on KEMSA. So I'm glad now at least we have 60 to 70% of drugs in the hospitals. But also many of the hospitals were dilapidated. The infrastructure was very bad. Because I'm very passionate on changing health in Kilifi, when I went round to hospitals, and I was doing it so regularly, and I still do, I realized there were small things which were quick wins. Today, we are, for example, renovating the Malindi Hospital. And when you go there now, you will see with very little money, we are able to renovate ward by ward. I'll be opening the new renovations of Malindi Hospital around the 12th of next month. And we are able to fix the hospitals with every bed having oxygen at the patient level. When you came in, you realized you had to move around with cylinders and whatever. We have run renovations. We have bought state-of-the-art beds like any other private hospital you go in this country, to give the patients the dignity of care when they come to hospital. And even the menu of the hospital. When I came in, I remember I went to Malindi Hospital, and when I went to the kitchen, I asked the cooks, because I saw them cooking in some drums, and I asked, this food is for who? for patients. When I looked at the plates they are using to serve, one is black, one is green, one is yellow, and but not because they are yellow, because they were dirty. And I was asking, what is this? And they said, oh, you know, patients come with their plates. And for me, it was, if you are running a hospital and you let patients, their relatives bring their own plates.
There are no standards.
The standards, number one. Number two, what if somebody decide to less a plate when they come from home with poison? Who is responsible?
Responsible for it.
So I changed that. I changed the menu. Now when you come to hospitals, now the new question I get from patients when I go around the hospital, they say, Governor, chakula itoshi. Because now they can have boiled eggs in the morning with toast. They can have chicken for lunch. They can have, we have a set menu for the week for patients, and now all of a sudden they feel it's too small. Of course, because now when the visitors come in, especially the relatives to visit their patients, then they start sharing the food with them because it's attractive now.
It's
looks
very
yummy.
attractive.
You can eat, but service delivery. What we have decided in the hospitals is to make sure that doctors are present. When I came in, the biggest thing we were facing is that patients were waiting for hours and hours and they don't get attended to. But what I did is I had my first 1 month, I had a breakfast meeting with all the doctors and the specialists in the hospital. We spent hours together and we agreed we are here to give service to the people, and we must change our way of working.
The narrative and way of doing things.
But it was also the doctors being passionate of their work, because as I was growing up, when you go to a hospital, you didn't have to be told this is a nurse, this is a doctor. But here you are, you go into a hospital and everybody is dressed like they're also patients who have come for service. So we agreed on several things, and now when you go to the hospital, doctors are working. The turnaround of guests, and I get always feedback from the public that, oh, the hospital has changed. I've been to the hospital and I spent 30 minutes, I left. We have gone even a notch higher now. We have started Malindi, soon we'll be in Kilifi. We have just finished building a civil servants clinic at the Malindi Hospital. What are we doing? We are trying to turn around the civil servants, our staff, that when they go, they have an express service also, so that when somebody does not get an excuse that I've spent the whole day in hospital, when they want us just a small treatment and they can get back to work. Okay. So we have an express service for all civil servants.
Great, Governor. And that is exactly where I wanted to go in terms of access, because many a times we have the buildings and we probably have the medicine in the hospitals, but even accessing these hospitals is a problem. And I understand that you have come up with a great ambulatory system. So then the question then would be is that how do we access these ambulatory services? And then two, where is the role of community health workers in terms of being integrated into the system, so that then anyone on the ground that is actually sick can actually access these services and actually end up in hospital to be taken care of?
What we are concentrating on a lot now as Kilifi County is primary health care. And when I came in, the first thing we did, and we have just finished in the assembly, passing the community health bill, which gives now the community health workers a stipend, because they have been working for free. They work for kilometers and kilometers helping our people on the ground, but they get nothing. So we passed a bill now for stipend, and I'm glad now nationally also the government has come up with the same program. So they are going just to get us ahead, because I think it has been proposed nationally, but they have probably not put a law on it now. But as we have as a county, so that we can make sure the community health workers are taken care of. We want even to go a notch higher, and I've already told the Department of Health to make sure that at least if we can buy for a start 1 motorbike per ward, which for the health, it can be stationed at the sub-county office, so that when we have healthcare workers who have to visit patients 20 kilometers away, they can even share to make sure that we reach patients much quicker, very fast. And it's working. It's working, and what we are lacking now is we have a shortage of staff. So we are trying to recruit now. Soon we'll be advertising to recruit more health staff. But we have just trained 32 youth. We've employed 32 youth trained for paramedics, so that our ambulance services, instead of people picking nurses from hospital when there's an accident or there's an emergency, the paramedics will be manning the ambulances. They have been trained. We had partnered with St. John's Ambulance. They have been trained. We have just bought a new fleet of ambulances. We are expecting more, because the ones which were there are used for 10 years. They are dilapidated. And our ambulance services are free of charge. When I came in, one of the first things I did was to make ambulance services free of charge. Why do you use an ambulance? Because that's the question I was asking the doctors and the officers there. That the only time you use an ambulance most of the time is when you are critical, when you have an accident. How can I have an accident on the roads? You pick me up and you say, if I can pay for the fuel before you run me to hospital. I thought it was ridiculous. So I said the ambulance services are free, because ambulances are not used for normal patients, are for emergency or critical care. And I think it's very sad that you start asking for, instead of helping somebody who is critical, start asking the family that, can you please give 10,000 for fuel?
For fuel.
Yeah.
It's and of course, given the income capacity of most people, of course, at the very basic level, they cannot afford 10,000 shillings. The other question then, Governor, that we'll be asking is the question of access to specialists, because we many a times we have these hospitals, and when you go there and you want your eyes to be checked and there's no optician, you want someone to look at your teeth, there's no dentist. How are we prepared in terms of ensuring that we have specialists in these institutions, and in the long run, because of course, ensure that they are well remunerated, so that then we can actually have them at our disposal at any point in time?
I think in Kilifi I don't lack specialists. Even the problem I've had with the County Public Service Board is because I have too many specialists, and they were saying, if you promote all the specialists to another grade, the wage bill will be so high, because Kilifi has more or less all the specialists, name it, including neurosurgeon. So we have all the specialists in Kilifi County. I think in total in the hospital we have about 40 specialists. And the only thing they have been lacking is facilities. What are we doing? We have had, when I came in, I went with doctors to several health exhibitions in Europe. I went to the Medica in Germany last November. We're hoping to go this November again. We have been to Arab Health, and we have checked the things we require as a county for healthcare. And we are trying also not only to buy as a county, but also to seek partnership with the suppliers. As we are talking, we are just about to finalize a urinal center in Kilifi Hospital. And we have partnered with the Hungarian embassy, and they have found us a medical equipment company is going to place all the dialysis machines, and we are just going to buy reagents as a county. Yeah, we have already put 6,000 people under NHIF. We have put another 60 million for this financial year. The other one, the budget was already done, so I could only do in supplementary one the 6,000 NHIF members. But now we are putting the main budget, 60 million, to recruit people under NHIF by the county, the vulnerable, the elderly, the youth. And especially now I'm doing one program with that NHIF with the chief officer and the CC member to target kids who have heart problems. Because I've just started a meeting now with an organization, some top doctor from Mombasa who does heart surgeries in London, and they have an organization, Healing the Little Hearts. And we are planning now to have a big surgical camp in Kilifi beginning of next year on surgeries or kids who have heart problems. So at the moment we are just trying to put them already under NHIF, so by the time we do the surgeries, we can be able to offset some of those bills. But it's not very cheap. But we have also made deliberate moves on making sure that we partner with different organizations for placement, because to buy today a CT scan will probably cost us $1 million, over 100 million. So we are partnering with different organizations. We have discovered now there's a new thing that we might invest on ourselves. It's a specialized machine for diabetes. Yeah, we want Kilifi County to be the first county in the very near future where you don't amputate legs anymore because of diabetes. Yeah? There's a special machine which has come up now where instead of amputing a leg because of diabetes, you just burn the wound and somebody can continue walking. So this investment we are going to do soon. We have already put it in the budget to buy this specialized machine. We have already the experts. We have partnered also with Tumbei University Hospital in Ajman in the Emirates, and we went there, and we are already looking forward to send some of our doctors there for specialized training, yes. And them sending also their people to see how Kilifi is working. So if there's one place we have really been able to attract partners is on health, okay. but also on we are trying now to attract more partners on technology, ICT, vocational training. Yeah. We have
just before we move there, deliberate efforts in the health sector, but something else that is also closely related to health is actually access to clean water. Shall we discuss the steps that you've actually put in place in terms of ensuring that people of Kilifi County can actually access clean water, so that then going forward we can actually focus on the vocational training?
Yeah, for example, the reason why we have delayed a bit on opening the urinal section of the hospital, which we have done, is because we realized the water was still not clean enough for the dialysis to go. So what did we do? We bought a desalination machine for the hospital, so that we purify more the water, so that we can get the water very clean to be able to use it in the dialysis center. But on water, we have also made a deliberate move. We have put our budget this financial year a lot of money on water, because for me, water is key. Even when we talk of health, if we have clean water, we will reduce the diseases, the waterborne diseases, by probably half. So what are we doing? We have made sure that the areas, we are trying also to do a lot of drilling to see where we can get water. When I came in, there was a problem of the only source of water in Magarini sub-county, where they had 11 boreholes at Kazandani, very rich boreholes, but they were all dead. So we have since revived 3, and we can pump water in all those, most of the areas. I was very happy the other day when I just went to do a delivery of relief food before they had started harvesting this season crops. And the first person who stood up said, we are glad after many years now we can access water in this place. But what did it cost us? Just to bring our machine of drilling there and workers for 3-4 days, spend there day and night to clean the boreholes, and now people can access water. We are trying also to see how many other areas we have water. We have just discovered in a place near Kaloleni, we have 4 sub-counties in Kilifi, mostly affected of water shortages, problems. That's Magarini, Kaloleni, Ganze, and Rabai. So what have we done in Kaloleni, for example? The other day we discovered, just close to Kaloleni, we just did a test and got a borehole with very rich aquifers. So we are trying now to see if we can do more boreholes around there, so that we can use now that place to pump water to Kaloleni. And we want to do this in all the sub-counties to see with our geologists if we can discover more aquifers in different areas, so we stop relying only on Baricho water, which is used by everybody. It's used by Mombasa. We share basically with other people. So that's what we are trying to do, but piping more water to the people. We are doing now a big project in Kaloleni, for example, starting from Mariakani, Mwavumbo, where there's a station from Muzima. We are trying to put a line into Kaloleni. We have started another one again, doing covering a long stretch of Rabai. But more so, we have said, apart from only pumping water, the biggest problem we have had also, you pipe water, then sometimes there's water sharing, so some people don't get water. So our new areas of intervention also is building water reservoirs. Yeah, we are doing in Rabai a 5 million liter water reservoir, so that at no time, even when you are sharing water with Mombasa, that you have 2 days water and 3 days no water.
The water rationing.
The water rationing.
Yes.
So what we are trying to do is we are building reservoirs. So once these reservoirs are full, and then you have to release water to Mombasa, then the 5 million liter will supply, so that there will be no day where there will be no water. So we are doing one in Rabai. There's another one we are doing in a place called Mutepeni in Kilifi South, which will supply then Mutwapa and those areas. Yeah, and we have, for example, this financial year going to get our royalties of mining. And we have clearly said that as much as the county had already budgeted for the financial year, it was a deliberate move. I told them, no, we are not touching this money for royalties for now. But when we have our supplementary one, we will then have what you call allocating that money. Mostly 70% of that money I want to put on water. And then we said the rest will go on to health.
And
so
other issues.
Because we are expanding now, we are doing an accident wing unit in Malindi, Kilifi, and Mariakani.
Fantastic. Yeah. Governor, then there's a special fund that you've actually set up to ensure that you can actually build the capacity of business women and youth in the county. Let's talk about it.
Yeah, what I did is when I came in, there was a fund called the Bego Fund. I think it had run about 220 million or 320 million in the last 10 years. But half of the money has not been paid back. So we said, hang on, can we change something? So what we did with the Department of Trade, Tourism and Cooperatives, first of all, we said we have a deliberate move on putting people in circles and cooperatives. And then number two, we changed a bit the act of the Mbegu and changed the name to Wezesha. Yeah, meaning this fund is to enable you. Yeah. So what did we do? We engaged several financial institutions, and then we advertise to make sure that it's competitive. So we advertised, we got many offers. Some of them said they will give us 1 shilling to 10, but then they wanted interest. I said we can't. We want to help our people. If we lend money to our people and then they have to pay 10%, 13%, it's not sustainable. So what did we do? We advertised, then we got among the many institutions, we got 2 banks which were able to meet our terms, because our terms was basically for us to put money and then the institution gives us more so that the fund grows. So what we did is we put 200 million as a county, and KCB and Rafiki Microfinance Bank gave us 4 shilling. So what do we have now from 200 million? We have 1 billion shilling for the people of Kilifi they can access with no interest. The only thing you pay is a service management fee of 4%.
4%.
So when you get a million shilling, you will have to pay 40,000 for the management fund, and you don't must pay it before you are given. Basically, we process all your money, and we give you 960 instead of 1 million.
1 million.
Yeah,
fantastic.
And we are keeping this fund for anybody, and we have an LPO financing. The biggest problem we have had in our county is, and I've done a survey. I have a team of chief officers even now doing the company's evaluation, and we have realized that 65% more or less of the business of the county is not being done by Kilifi people. So I made a deliberate move bringing this fund.
And that is because from Kilifi County cannot afford to actually raise resources needed.
Yes, that's why we brought this fund. So that now we are not only having lending money, but we have an LPO financing. Once you are a Kilifi resident given an LPO by the county, but not only the county, we have said even the members of parliament, if you give a resident of your constituency an LPO from CDF and they have no money, they can get money from the Uasin Fund. That means you will get the money, you can do your project. During the signing of the contract of the project with the LPO financing, you'll be able to indicate the bank. So if it has come from Rafiki, the bank account which will sign it, your contract to be paid through is from Rafiki. If it's from KCB, when you do the final contract before you start work, it will be written your bank account. So when the chief officer of finance is paying, we'll pay through those accounts. So there's nobody saying, oh, I was paid, then he ran away with the money, because the money will be paid through the bank which we are in cooperation with on developing our people. But we have even gone a step further now. In this financial year, we are starting a new system, because we realize also, as much as we are going to give these people funds, but if they don't assess business, then it's waste of time. So what we are saying is the Financial Act, Public Finance Management Act, allows us to also restrict tenders. So we are saying as much as we'll have probably 60% of tenders which will be open for everybody, but we are saying we want to try this financial year to see if we can restrict 40%. The AGPO projects, which is access to government procurement opportunities for the youth, women, and people living with disability, that we can put a tender and say this particular tender is restricted for Kaloleni's constituency. This particular tender is restricted for Malindi constituency, so that our people now can start getting opportunities. Because if you leave everything open, the ones who have more muscles, they always push out the local community. So we are saying we are going to restrict. Some tenders will even be restricted. If you are building an ECD in a ward, in Kilifi town ward, why do you have to get somebody from very far
to come and
how
build that?
How do you grow the people financially?
But Governor, people will be asking in the past, administrations actually setting up these funds. The biggest question has been access. How do you ensure that more and more people, because yes, we put out their resources, and the issue of encouraging our people to actually come out and access these resources is what keeps on letting us down. How do you ensure that actually this Wezesha fund can actually Wezesha?
You will be shocked what is happening in Kilifi. What is happening in Kilifi at the moment? Like I've seen deliberate move with the Rafiki Bank, KCB doing equally the same, but you'll see the crowds of both women and members of the public, they're assessing on the ground. The other day I received from one of the managers of Rafiki Bank, and you could see they talk like up to 10 groups in a day, and people are so excited with the fund. First of all, it was the sensitization was not there, of that there is this fund you can assess. And we have said to do it at ease. That's why I talked of the cooperatives and SACCOs. And number two, we have said, apart from other collateral to this fund, is one of the things we have even gone ahead and said, we check your M-Pesa account. How much do you transact, for example? That becomes also part of your security of that fund. But we're encouraging now our cooperative department is up all over the place, trying to register people in cooperatives and in SACCOs. Why were we doing that? So that because people put some kitty for their SACCO fund, it becomes savings, yes. It becomes the security of the whole group. Because you can access the fund individually and also through the SACCO. Yeah, that way you will be able always to get back the money. And we have said already, for example, to borders, in all my public meetings I've announced it, that the moment they form their SACCOs, and we have done 13 border SACCOs already at the moment, we are doing more. Even the county staff do not have a SACCO. We are doing even our own SACCO, where me as a governor will be a member. So what we are doing is we are trying to bring, for example, we said we start with the borders, that once we put them all in SACCOs, then they don't have to pay any license. They normally pay 300 a month to the county, as their fee. So we are saying your license will be you contributing to your SACCO. So once we have done this border SACCOs, then we'll wipe out the 300 shilling fee. But what is the condition? The condition is one, that your license will be you proving that you have paid to your SACCO. Then we'll give you a sticker as a county that you have paid. Because we want to force the border guys to save money.
Governor, fantastic. Talking about money, talking about revenue collection.
On-source revenue.
On-source revenue in Kilifi County. And I was going through some literature and I realized that the county is being owed close to 30 billion shillings.
Yes.
That money is enough to do quite a lot. How do we then ensure that we can actually recover that money and put it to good use?
We are doing different interventions as a county. Number one, we have improved our collection processes. For example, if I tell you on hospital, because we have been very keen, we have moved in the last 11 months from 280 million, which was being collected before, to 480 million. In less than 1 year. When I took over office, the county government was collecting, the highest they have collected was 800 million in 10 years. When I came into office, they had already collected in August around 115 million. By the time we closed the year on 31st of June, I had managed to cross to 1.1 billion. We already have recruited a partner on revenue collection. Our target is by the end of this cycle of electoral period, if we can move Kilifi County to above 2.7 billion. And it's possible. We have already seen on our own collection we could move by just doing few measures. We have moved to 1.1 billion in less than 8 months. We have moved the hospital in less than 10 months from 280 million to 480 million. We have already put an AMR system in the hospitals, for example, which will work on two things. We'll be able to have medical records. What it will help us with? It's very prone in many of the hospitals that everybody runs around with an exercise book. So we want to get rid of that, number one. But number two, the EMR system will be able to control our medicine consumption. Because once you have it on record, track the medicine, how it's used. We have already now put 18 dispensaries out there with that system. We'll be able to know dispensary X, the drugs are going down and this replacement.
And what they have actually raised in terms of
we even bought a delivery truck
fantastic
to make sure that we... So what are we doing? How are we going to improve the revenue collection? One is one of the measures we have put, that instead of buying medicine, which we don't know where it's going, the money we get in the hospitals will buy medicine which is properly used and our financial bed raises. The new, for example, the new wing we are doing, the accident wing we are doing in Kilifi Hospital, is going to be funded by the hospital with the money we have been able to collect. In the last 3 months, we have been able to collect 30 million from NHIF. Before it was like 2 million. Yeah? And we are putting more people in NHIF. Because NHIF is you pay from the left hand and receive it in the right hand. So this way, we hope that in the next financial year, Kilifi will be able to collect. We have targeted because we don't want to be. We are ambitious, but not too ambitious because we are still putting measures in place. I can guarantee you, between now and June next year, if we collect very little as a county, it will be 1.8 billion. But we are targeting 2.5. But on the credit we are owed, mostly is on lands, land rates. So the measures we are put now is we are putting debt collectors. Like now, if you those who read newspaper, they'll see last week we advertised for debt collectors services for the water companies, because we are owed only on the water companies, Malindi and Kilifi, over 800 million. Can you imagine if we collect all that money and how much water we can put to our people? So those are some of the measures we are doing. You will see the last days in the news, I was going around supervising the new county court, which we are about to start. We are waiting for a magistrate. We will be able to now bring these people who are not paying their rates, so that if we want to recover our money, we'll have to auction some of these properties. So I think we'll earn money in two ways in the county court. We'll be able to people will be able to pay back. And also because when you have not paid, you'll be fined. So we'll also raise money from that.
More resources. Great. Lastly, we are being told that there's some other live event that is actually supposed to go there now. The issue of tourism, just in conclusion, where are we in terms of ensuring that, yes, we are blessed with very good beaches, we are blessed with good weather, that indeed we reap maximally from the God-given gift of good weather conditions, and of course the beaches and what have you in our, and of course culture also.
We are doing a lot on the tourism marketing, and yes, you are right, we have targeted culture. We just finished a cultural event this Sunday of Mekatilili or Menza, but we have had many culture events since we came into office, but we're also targeting sports. Yeah, we want to make sure we have 3 areas we are targeting as Kilifi County. If you see at the moment, we have even global meetings. Don't have the only sad thing is a county, we don't have a convention center, but the ones which are from the private sector, because we also want our private sector to grow. So we didn't want to also to rush in to start building our convention center, then they start losing business. But we have had as much as the global conference on Action Aid a few months ago. So we are targeting conference tourism, sports tourism. You must have seen that we have been partnering even the other day with Nation Group to fund a golf tournament. We have just finished one this weekend. We funded and we attracted many people from Nairobi. So we want to target conference tourism, sports tourism, and we have the biggest, Kenya Ladies Open, the Magical Kenya, which is a very popular event now in Kilifi. I just came back in June from Germany there was a big event sponsored by Porsche, and now I think they're coming in a big way in February in Kilifi. So these are part of the targets we are putting, because we don't want to go the traditional beach to holiday only, but using the beach as an attraction have been overstretched. Using the beach as an attraction, but attracting people to come for conferences, to enjoy our beaches. The only thing we are lacking at the moment, and we are really pushing national government at the moment and talking, we even told the president the other day when he visited, we want the Malindi Airport to be expanded. The moment we can just expand the runway, Malindi Airport, International Airport, then we are good to go. And that's what we are trying to look as a county, that we are able to put more resources and not over-relying on only what you call the typical tourists from Europe, but that we can sustain our tourism also locally. And we have seen it's working. The other day we had only Kipra, the Kenya Institute for Public Policy. There was no room in Kilifi town. All the hotels were full. So meaning we can boost our tourism by also attracting more local tourism through conferencing, conferences and sports.
Fantastic. Of course, Governor, just expanding to us what exactly is happening in Kilifi County under his administration, just to ensure that indeed the people of Kilifi County get the services that they deserve. It is a conversation that, of course, we will continue off camera, so that then we can actually ensure that the people of Kilifi County and, of course, Kenya at large can actually get to know exactly the good things that Devolution has actually done in Kilifi County, but more so importantly, how they intend to surmount the challenges that come with the implementation of devolution across the country. Back to you, Victor.